Good morning, Mr. Lai. How are you feeling today?
早晨，醫生，我今日好好，你呢？
I'm also doing well. Thank you for asking. So, we're here today to discuss your upcoming colonoscopy. A colonoscopy is a procedure that allows us to visualize the inside of your colon and rectum using a flexible tube called a colonoscope. The colonoscope has a light and a camera at its tip, which will allow us to identify any abnormalities, such as polyps, inflammation, or signs of cancer. Have you heard of this procedure before?
聽過，但係唔係好清楚測試會點樣進行。
That's okay. I'll explain everything. The colonoscope is inserted through the anus and advanced into the rectum and colon. Once in place, we will carefully inspect the lining of your colon. We can also take biopsies if needed, or remove polyps. Polyps are growths that develop on the inner lining of the colon. They are usually benign, but some can develop into colorectal cancer over time if left untreated.
我會唔會感到痛楚或者唔舒服？仲有，咩係活檢？
Most patients don't feel significant pain, but you might experience mild discomfort or cramping as we inflate the colon with air. This helps us get a clear view of the colon's lining. You'll be given a sedative through an IV to help you relax and feel comfortable during the procedure. Some people may also receive analgesics to manage any pain. To answer your question about biopsy, it means a small sample of tissue is taken from the body to examine it under a microscope for signs of disease.
程序需要幾耐？
Typically, a colonoscopy lasts about 20 to 30 minutes. Afterward, we'll monitor you for a short period as you recover from the sedation. Most patients are able to go home the same day.
呢個程序可唔可以選擇全身麻醉？
Typically, we don't use general anesthesia for this kind of procedure.
做腸鏡檢查之前有啲咩準備要做？
Preparation is key. You'll need to cleanse your colon thoroughly so we can get a clear view. This is done by drinking a bowel preparation solution the night before the procedure. This solution causes diarrhea, which empties your intestines. You'll also be on a clear liquid diet 24 hours before the procedure, which includes broths, tea, water, and certain juices.
可唔可以飲咖啡？我每朝都要飲咖啡。
The meaning of clear liquid is that if you pour the liquid into a glass, you can see what's inside the glass. Coffee and milk are not considered as clear liquids.
如果我唔跟足準備嘅指示會點啊？
If your colon is not adequately prepared, it can interfere with the procedure. Incomplete cleansing can lead to a poor visualization of the colon, and we might not be able to detect polyps or other issues. In some cases, we might need to reschedule the colonoscopy.
仲有咩我需要知道？
Make sure to arrange for someone to drive you home after the procedure, since the sedation can affect your ability to drive. You may also experience bloating or mild cramping after the procedure, but these symptoms should go away within a few hours. It's important to let us know if you experience heavy bleeding, fever, or severe pain, as these could indicate complications.
結果幾時會知道？
We'll discuss the results with you after the procedure. If we find something that needs further testing, we'll schedule a follow-up appointment. If no issues are found, you can usually continue with your regular activities.
多謝醫生解釋，我而家明晒啦。
You're welcome, Mr. Lai. We'll take excellent care of you. Do you have any other questions?
係唔係而家約時間啊？
Someone will call you to schedule the appointment.
好，多謝。
Great. We'll see you on the day of your colonoscopy.